Hi everyone, it's Dr. Nikki. Thank you so much for being here today. So today I am updating you on my post-Tijuana trip, my post-amalgam filling removal trip. And it's been about a little over a week, and let me tell you, I just feel better. My mouth is a little bit sore for sure, like when I'm eating certain hard foods. But overall, I feel almost like a weight has been lifted from my head. And if you look, even my smile is improved. And all of those metal fillings that I showed you last time are now all gone. I was a warrior and I did it in 2 days, got them all out, and I'm so happy. So taking a look, and yay, that's all done. And I want to talk to you a little bit more about this whole amalgam public health issue. So I'm really surprised that the government, the CDC, has allowed for the continuation of the use of amalgam fillings. It's really a health hazard. In medical school, we learned about the craftsmen who would lick the tip of their paintbrush as they were using paints and mercury for various projects. And eventually they became crazy, and there was a lot of motor issues and neurological disturbances, and it is definitely a neurotoxin. And 50% of amalgam fillings are mercury. So it just boggles my mind that this was allowed. 72% of the population doesn't even know that the metal fillings in their mouth contain mercury. And as I mentioned in the previous video, it's linked to a whole host of diseases. And even if we think about, does it even make sense to have metal in our mouth? Like, no, we weren't intended to have metal in our mouth. And so I don't know where along the lines that was approved. It drives me crazy. I really want to create awareness around this topic. It is important to seek out a biodentist if you wish to take your metal fillings out for several reasons. One is you want to make sure they're using proper protocol for your health. So the Huggins protocol is one of the most well-known protocols, and not all dentists are certified in Huggins protocol. And there's basically, you want to be sure that a barrier is in your mouth so that you don't swallow the metal as it's being removed. You want to make sure the dentist changes his gloves or her gloves and changes all of the materials once the removal happens. You want to make sure there's a negative ion filter in the room. They're using a cold spray in your mouth, and you're able to rinse your mouth once it is all taken out. And you also want to find one that will be doing IV vitamin C during the process, which can act to help chelate the metals and as an immune booster. And I understand it's actually really expensive to do this in the US, and that's why I went down to Mexico. And you can email me at drnikki@drnikkinoce.com to find out about this dentist. And I highly recommend seeking one out that's trained as a biodentist specifically. The other reason why you want to see a biodentist is because they generally get rid of this toxic material in the appropriate way. You don't want it just flushing down the drain, because then you'll end up polluting our earth. And I'm really so happy that I was able to do this at a fraction of the cost, because that's generally what stops people from doing this. And I would like to just spread the word about this, because your health is really important, and it's unfair that many parents didn't even know, or even people don't even know, that they should be saying no to these metal fillings. That extra cost to get the composite filling is really worth it. And I wish you a beautiful day. And thank you so much for being here. Please subscribe to the channel and leave your comments in the box below. Thank you so much. Bye.